The yeast microorganism can be found naturally upon the skin, in the mouth area, vagina, as well as the digestive system of the majority of healthy females on this planet. It generally will cause no damaging effects. Friendly bacteria and also the immune system ordinarily work together to keep the levels of yeast under control. An outbreak of yeast might occur if any of the levels of the beneficial bacteria in the body changes or the immune system is weakened. Someone's likelihood of contracting a yeast infection depends on many variables. Those with compromised immune systems may well develop them more easily. Individuals have more difficulty warding off yeast infections when they have disorders like AIDS or HIV. If the victims of diabetes have a raised level of sugar in their blood, then this can feed the yeast, letting it grow more rapidly. They furthermore have the challenge of a weaker immune system to contend with. Along the same lines, anyone that makes use of immune-suppressing drugs is also open to an infection. Factors such as stress along with insufficient sleep can also damage your immune system. Try to avoid wearing any tight or wet clothing. Use natural fabrics, something like cotton. Synthetics make you sweat more and will provide a yeast-friendly environment. Excessive sugar in the blood can aid a yeast infection, so eliminate as much sugar and processed food products from your diet as possible. There are good bacteria in our bodies that help control the growth of the yeast fungus. Antibiotics cannot discriminate between good and bad and unavoidably wipe out some of the good bacteria. This then takes out another control element that helps keep yeast in check. There are many occurrences where people have contracted an infection once a treatment of antibiotics has been concluded. Some condom lubricants and a few contraceptive pills may additionally increase the risk. A systemic infection has to be taken a good deal more seriously than its close relatives, the genital or oral infection. An infection could become systemic the instant it moves into other areas of the body not typically associated with infections. See your doctor directly when you think you have a systemic infection. If you prefer to use holistic treatment instead of OTC, I recommend you to pick up the ebook Yeast Infection No More, written by Linda Allen. I have used her unique 5-step method to help me cure my yeast infection in as little as 12 hours. In addition to the regular infection warning signals, the systemic type can potentially include a creamy-colored release from the genitals. The symptoms are actually a challenge to identify, as they are not condition-specific. Other signs of an infection changes depending on the individual. Excessive gas and an upset stomach without good reason. The vagina can be extremely enlarged along with the rectum. Because the vagina may become dry with this type of infection, slight skin cracks may appear that will be very sore. Even the rather simple job of walking may be painful. If the systemic yeast infection were to arrive at the brain, then in that case it could actually become a very dangerous disorder. They are most commonly encountered in people with diseases of the immune system or those who have diabetes, as the bodies in such groups will probably have problems fighting off a yeast population bloom. They may also be vulnerable to other types of yeast infections. Another issue such groups may have is always that almost any infection will be doubly difficult to eliminate, and it could be a frequent problem. Those normal yeast infections that target the genitals and mouth areas are, in many cases, more of an irritation than dangerous. Nevertheless, they should always be attended to ASAP, especially for those with impaired immune systems.